Well, CEREC is an acronym that stands for Chairside Efficient Restoration with Aesthetic Ceramic. And what it actually is a computer system that we use to restore many teeth in a single visit. Whereas in the past, oftentimes, we would take impressions, make temporaries, and require our patients to return for a second visit to get their crown seated. Nowadays, in many cases, we're actually able to take that particular tooth from start to finish in one day. And the biggest benefit for our patient is that it is a single visit. Nobody has to come back for a second visit. There's no mouthful of impression material, and there's no temporary that you have to manage for several weeks. The porcelain that we use in that process is exactly the same porcelain that the laboratory uses. And what's different about that is that we use a computer in a CAD/CAM system, which stands for computer-aided design and computer-aided milling. So the process from the patient perspective is relatively simple. We go ahead and get the tooth numb. We shape the tooth much like any traditional crown would have been shaped. And then instead of the impression, we actually use a special camera. We bring the camera in and take some digital images of the tooth, and then I sit with the computer right next to the patient, and we design on the screen exactly what we want that crown to look like. After that design is finished, then we use a second machine to take a block of porcelain and then almost magically carve that crown from that block of porcelain while you wait, and many times while the patient is watching the process. At the end of that, we fit that crown just like any other crown from the laboratory and bond that crown in, one visit, and we're done.